G'day, welcome back to the channel. So in today's video, I want to talk to you about orthotics. And in this video, I want to hopefully give you a better understanding about why an orthotic isn't a solution to arch-related issues. And following on from that, I want to give you maybe 2 exercises that you can take with you to work on that will hopefully start to help you reclaim better arch function and give you the confidence that you can begin to go down a path that will lead you to getting rid of your orthotics long term. Getting into the topic that we want to discuss in terms of orthotics, it's important to discuss a few different things. The first thing is the obvious connection between using an orthotic or a shoe insert to help support poor arch function, because we see that arch collapsing is a very closely related issue to a lot of common lower leg complaints. An arch support will help support an arch that is collapsing, but it will not stop your arch from wanting to collapse. So as soon as you take away that arch support, you haven't fixed anything. It's just a temporary solution that you now need to rely upon in order to get some symptomatic relief. And the way that I like to use orthotics, truth be told, is that I have no issue prescribing an over-the-counter pair or getting them to see a podiatrist to get a really custom fitted orthotic, but I need to make sure that my patients are working on the broader contextual issues that are causing that arch to collapse in the first place. Now, we've done a video previously that discusses why an arch issue isn't a foot problem, it's a leg problem. But to summarize that, essentially what we tend to see is that when you're looking at an arch that's collapsing, so as I let my arch collapse here, we're actually witnessing the consequence of the entire leg functioning poorly. So if I stand with my feet straight and let my right arch collapse inwards, what you'll hopefully notice is my entire leg rotates inwards. So my hip closes down, my knee caves inwards, my entire leg rotates inwards to allow that arch to collapse. So if you can hopefully appreciate here, if I put an orthotic underneath that, then yes, it's not going to allow my arch to collapse, but as soon as that orthotic goes away, that arch is going to keep doing what it's intending to do because now you've taken away that artificial support that was stopping it previously. So we need to ask a much more broader question in terms of what is causing your leg, your entire leg to collapse, and asking that arch to collapse in the first place if we truly want to get to a point where we don't need to rely on orthotics long term and you can become someone who used to have orthotics in your shoes. Now obviously there are a whole range of different things that can conspire against you to create that dumping inwards mechanism, but the main 2 that I find tend to be ankle restrictions and hip restrictions. Now the reason why I find restrictions to be the most powerful is that they ultimately don't stand out unless you're looking for them, but they force your body to work around a restriction. Now there are other things obviously like core strength and glute strength and a whole range of other things that I would advise you to see a podiatrist or a physical therapist or a physiotherapist to figure out where you need to get better. But for the purposes of this video, we're going to go through some ankle mobility and some hip mobility exercises to give you better capacity to maintain a better shape and not force that ankle to collapse and that arch to collapse and then rely on an arch support to hopefully prevent that from happening. Now, the best ankle mobility exercise that I've ever seen to quickly and effectively improve the amount of ankle range that you actually have is the banded ankle stretch. And if you're trying to improve the function of your arch, it's really important to make sure that the actual ankle joint itself isn't a point that your body's consistently trying to compensate for and causing you issues in terms of your arch function. Now for me, the way that I like to do this, and you've got 2 options depending on which one you feel is the best for you, is you want to fix the band to a surface that's not going to move. You want to attach the band either below your ankle or above your ankle joint, depending on what you feel gives you the most benefit. In terms of ankle mechanics, it is technically best to have the band below your ankle, have your foot up on something, but some people find it actually gives you a greater benefit to have the band above the ankle, particularly in the position that we're about to get into. So all I want to get you to do is take a big step out as far as you feel comfortable. We want to bend that ankle as far as you feel comfortable. Now again, what we always do with this exercise is we need to make sure that you're in a good position. So if we turn side on, but imagine that the band is still pulling backwards here, what we want to get you to do is if you bend your back ankle, we know that if there's an ankle restriction that your leg is trying to work through, what your knee will do is it will start to deviate inwards to go around that ankle restriction and allow you to go further into the stretch. And again, as we've already established, as soon as that knee wants to cave in to go around a stiff ankle, that arch will also collapse. So we need to make sure that in the purposes of this exercise, that we keep your knee out and you're going just as far as you feel comfortable without feeling like that whole leg wants to start to cave in. And what you'll find is that that ankle exercise is a fantastic way to then start to take away some of those handbrakes that will force you to dump inwards. Now the second set of exercises that we want to touch on revolve around hip mobility. And this is really interesting because there are two aspects of decreased hip mobility that seem to force the leg to compensate around that. Now the first is restrictions at the front of the hip, and the second is a lack of hip external rotation. So one of the things we can see here is when we're walking, essentially we want to be in a linear plane when our legs are moving. So in order to do that, we need to take our hips back into extension. But if you are tight at the front and you can't go back as far as your body might want you to, your body can then start to rotate around that and circumduct the hip to get around that restriction. Now, what that ultimately leads to is it ultimately leads to a foot that tends to want to point outwards as opposed to one that tends to point forwards, which can then lead us to walking through our feet and collapse those arches. The second thing that we can see is that if you don't have the required hip external rotation, which essentially is allowing your knee to stay in an externally rotated position, then it will force you to dump inwards a little bit more. So what we want to do to combat these two things is we want to go through a couch stretch and a pigeon stretch. So again, the couch stretch is one of the best hip flexor, anterior hip tightness related exercises that you'll find. What we want to get you to do is either in the back of a wall here or up on a chair, so your shin is vertical up against the back of a chair or a wall. What we want to get you to do is starting relatively horizontal, push that front of the hip to the ground, just get a sense of how this feels. Then tense your glutes, squeeze your quads, squeeze the front of your thigh, push your knee back down into the ground, get that tissue to tense up. And with that maximal tensing, when you release that, you should feel like there's a little bit of relaxation that happens through that tissue, and you might be able to go a little bit further. Part two to this is you've got to be able to come up as tall as you feel comfortable here. You might find that there's a hell of a lot of tightness through the front of that hip, which is what we're looking for. Same thing as before, give it a good squeeze, tense that tissue up as tight as you feel comfortable, push your foot back into the wall, get everything to tense up, then relax. You might find you can go back a little bit further. And then ultimately what you'll find straight away is that when you are walking, it'll be easier for you to leave that foot behind, and you might feel like it's easier to keep your feet a little bit straighter. Now, in terms of part two to this, in terms of the pigeon stretch, the next thing we want to get you to do is, again, on the ground or onto a couch or a seat, we want to make sure that you have this externally rotated hip position. Try and be up nice and tall through your trunk. Again, tense everything. Squeeze your glutes, push your foot down into the ground, give it a little bit of time, and then release. You should find you can just drop down a little bit more into that externally rotated position. If you can get all the way down, then obviously challenge yourself in terms of how far you flex that hip. Again, don't just bend your back. That's cheating a little bit. Try and keep your back straight and hinge forward from that hip, from that position. And then again, what you'll hopefully find is when you're moving, when you're squatting, you won't feel the need to dump in as much as you would before. So by cleaning up some of the restrictions through the front of the ankle, the front of the hip, and the rest of the hip, among other things, we can start to have a really important and broad conversation about why the arch is collapsing in the first place. So if you're someone who is relying heavily on arch supports and orthotics to help manage your symptoms day to day, then you're not going to fix anything long term. You are going to be stuck in a vicious cycle of needing to use these orthotics to hopefully help you get by day to day. If you could just figure out what is it about your mechanics that is conspiring against you, then start to work hard on trying to remove those tightnesses and stiffnesses or improve some of those weak areas, then ultimately you can get to a point, or you should be aiming to get to a point, where you can have a conversation with your podiatrist, physical therapist, or your doctor, where you can get rid of those orthotics going forwards. So I think this is a really important topic of conversation that I don't see us talking about enough, that orthotics do have a genuine role to play for a number of different reasons, but it seems that we give you a pair of orthotics and say, that's you forever. You now need to put these in all your shoes. If you don't, then you're gonna have pain. It doesn't allow you to walk around barefoot. It certainly doesn't give you the confidence that you're gonna fix your problems long term. I hope that was genuinely helpful. Let me know in the comments down below what your thoughts are on orthotics, on shoe inserts and arch supportive shoes. Slap a like down below, subscribe to the channel if you are new, but we'll see you in the next one.